Hi, I'm Joe Graydon.
I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy, where we bring you the stories behind the health headlines.
This podcast is brought to you by Redix Industries, makers of Utterly Smooth Body Cream. 800-345-7339, on the web at uttercream.com. For thousands of years, people have relied on products from nature to treat skin problems like itches, scratches, and rashes. How well did they work? This is the People's Pharmacy with Terry and Joe Graydon.
Natural skincare products are becoming very trendy. Doctors may not be fully aware of the value of botanical medicines in the field of dermatology. One distinguished dermatologist has made the study of drugs from plants his specialty.
Dr. Dan Siegel, clinical professor of dermatology at SUNY Downstate and former president of the American Academy of Dermatology, shares his expertise on hemp oil, shea butter, oats, and urea in treating common skin problems.
Coming up on the People's Pharmacy, home remedies for dry skin, fungal infections, and lice.
First, this news.
In the People's Pharmacy Health Headlines, a new study shows that inflammation may be as important as high cholesterol when it comes to heart disease. Researchers have known for years that statins work through two mechanisms: a cholesterol-lowering effect and an anti-inflammatory action. A large trial compared a unique anti-inflammatory medication called canakinumab to placebo. 3 different doses of the medication were tested. The 4-year study included 10,000 people who had had heart attacks. The FDA has approved this medication to treat inflammatory rheumatological conditions such as juvenile idiopathic arthritis, but not for heart disease. The investigators report that volunteers on the 2 higher doses of canakinumab were about 15% less likely to have a heart attack or stroke. There was no difference between any of the groups with respect to mortality. Because canakinumab works by dampening the immune system, it is associated with a greater risk for infection. The results were presented at the European Society of Cardiology meetings and published in the New England Journal of Medicine.
The same trial, nicknamed CANTOS for canakinumab anti-inflammatory thrombosis outcome study, examined the effects of this anti-inflammatory compound on the risk of developing cancer. Study subjects taking the higher doses of canakinumab were significantly less likely to come down with lung cancer during the trial period. Those on the highest doses were 50% less likely to die from lung cancer. None of the patients had cancer of any sort other than skin cancer before the trial began. Because people taking canakinumab had more fatal infections, the number of deaths was not significantly different among the various groups in the study. This research was published in The Lancet to coincide with the presentation of the data at the European Society of Cardiology meetings in Barcelona. The investigators admit that this is hardly the final word on whether canakinumab could be helpful in preventing cancer, however.
For years, we've all been admonished to skip butter and other sources of fat, especially saturated fat. Now, however, it seems that the bread may be riskier than the butter you put on it. Scientists who conducted the prospective urban-rural epidemiology study reported at the European Society of Cardiology meeting that high consumption of carbohydrates was associated with a greater risk of premature death. They collected data on 135,000 adults in 18 countries for more than 7 years. The participants filled out carefully validated questionnaires about their usual diets at the start of the study. Higher overall fat consumption was associated with a lower likelihood of dying during the study. People who ate the most saturated fat, in particular, were less likely to suffer strokes. This unexpected result prompted the authors to suggest that global dietary guidelines should be revised.
Should you have another cup of coffee? Previous studies have suggested that coffee drinkers might live longer. New data presented at the European Society for Cardiology meetings seem to confirm that view. The volunteers in this study were approximately 20,000 adults who graduated from the University of Navarra starting in 1999. Their average age is 37. 10 years of follow-up revealed that those who drank at least 4 cups of coffee daily were about 64% less likely to die during that same time than those who never touched the stuff. Such young people don't die very often, however, so the absolute risk of premature death for people who don't like coffee is probably still very small. The investigators report that the benefits of coffee are clearest for people who are at least 45 years old.
A compound that is notorious as a popular drug of abuse at raves might someday be prescribed to help people with post-traumatic stress disorder. The agent is MDMA, also known as ecstasy or Molly. Surprisingly, the FDA has designated this potential medication as a breakthrough therapy for PTSD. This clears the way for Phase 3 trials to see how well the drug may work for people who are overwhelmed by memories of a traumatic event. And that's the health news from the People's Pharmacy this week.
Welcome to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. Before there were drugstores and fancy pharmaceuticals, Mother Nature provided us with most of our medicines. This was especially true for skin problems. Humans have been coping with bug bites, rashes, cuts, scratches, and lice for millennia.
To find out how natural products can be beneficial for the skin, we turn to Dr. Dan Siegel, clinical professor of dermatology at the State University of New York Downstate and director of the Procedural Dermatology Fellowship. He's a former president of the American Academy of Dermatology.
Welcome to the People's Pharmacy, Dr. Siegel.
Thank you. It's a pleasure to be here.
Well, we're delighted to have you on the People's Pharmacy. Dr. Siegel, if we turn back the clock a couple of hundred years, maybe 1,000 years, I'm guessing that a lot of our ancestors had to deal with skin problems, maybe cuts, scratches, wounds that they maybe experienced in battle. They didn't have the advantage of modern medicine. They didn't have antibiotics. They didn't have anti-inflammatory creams and lotions. What did they do?
They use plants. Plants have been around with us. They co-evolve with us. And we learned by trial and error. And those of us who are here today to talk about it, our ancestors are the ones who didn't kill themselves by accident. But they learned which plants might have therapeutic benefits, which plants might help them heal, which plants might make them better, which plants might make them itch less. There's a whole lot out there, and much of what we use that comes in tubes today really evolved from what we found in plants, millennia ago.
Dr. Siegel, I think a lot of your colleagues, if you said to them, what about plant-based medicines? They're going to give us the look that says, what are you talking about and why would you be interested? So how did you get interested in plant-based medicine?
Well, I grew up in Queens, New York, with a little house with a backyard, and we grew things in the backyard, radishes, tomatoes, carrots, basil. So I was always into gardening. And of course, in my teens, back in the late 60s, early 70s, one's interested in other things that you can grow in a garden. So these interests co-evolved, and it was something that I didn't really think about as a specific topic, but was very fascinated in medical school by pharmacology. And in those days, medical school, they taught you basics, and you learned that digitalis came from foxglove. You learned that certain antibiotics came from soil organisms. And it really brought things together like, wow, we're still using some of this stuff, but more applied. More recently, a medical school curricula have shifted to problem-based things where they teach you about a patient with a problem and you pick the medication, and there's a move away from thinking about where things come from. It's more, can you pick the right solution and relate to the patient? And we've lost some of that connection to the past. But it's really right there every day with both, obvious plant-derived supplements and with many of the drugs we still use.
Well, let's go back to my first question. Those cuts and scratches and wounds, for example, that people probably experience quite frequently. We've heard from some healthcare professionals, including a surgeon, that sugar, or more to the point, honey, actually had a place 1,000 or even 2,000 years ago when people ended up being injured. And I think today there are a lot of doctors who would look at you askance if you said, well, yeah, honey or sugar has a place in modern medicine. What's your experience, and what does the research show us?
Well, both work great. And we're seeing a lot more with honey these days than we were seeing even 5 years ago. One reason I think we will not see a lot more with sugar is there's no profit margin in it. If you have a wound and you dump sugar in, the sugar creates what's called a hyperosmotic environment. It sucks the moisture out of cells, and it does that in a fashion that's more dangerous to bacteria and other unpleasant organisms than it does to tissue. And the effect it has on tissue is it induces the body to create healing structural tissue. It's called granulation tissue. So just simply dumping sugar in a wound works fine. I learned about that from some of the older patients I took care of when training in Dallas back in the 80s. The problem, though, again, with sugar is not only will it never be a profitable thing, but it does attract bugs. It doesn't stay in place easily. Honey, on the other hand, stays. And when I talk to patients about using honey, which I do use a lot of, I tell them to go to the supermarket or the local farm store and find some honey that when they turn the bottle over, it doesn't run. So I tell them the stuff in the squeezy bear may be fine on a pancake, but it doesn't stay where you put it. You want something more granular. And really, any honey works well. The big push for modern honey is a product called Honey that's an irradiated Manuka honey from New Zealand. And most of the work done on that's proven the honey is effective has been done by a foundation that supports the honey growers. And it's nice work, but some further literature pointed out that regular honeys, your multifloral honey, your chestnut honey, all of these will work just as well. And honey is wonderful. There's very few concerns about danger. There's a theoretical risk that spores you may find in honey could be dangerous to newborns. But other than that, there is no problem taking honey from the jar. In fact, if the listeners would go to their closet, almost everyone has a bottle of honey that's a couple years old, 10 years old, and the honey's perfectly fine because nothing lives in there. Honey is great for wound healing.
Well, let's be very specific, because some people have bed sores and they're very, very hard to treat. And we've heard from some old-timey nurses that when, the modern medicine stuff doesn't do the job, they get out the sugar or they get out the honey, and it seems to work. So what kinds of wounds would sugar, or more specifically, the kind of honey you're talking about, what would it work for?
Well, really anything. They could work for a burn that you get in the kitchen or, touching a hot exhaust pipe on a car. They can work for surgical wounds. I do a lot of skin cancer surgery where we have wounds that we often let heal by what's called second intention. That's natural healing, where the body fills the wound in with structural cells and creates a matrix that it can then resurface with skin. And many areas do very well, and honey is a good dressing. When you have a wound that you want to heal, you want to keep the wound bed moist, regardless of what the cause of the wound is. So honey keeps it moist, but anything that decides to invade and grow in there, the honey destroys very effectively. Now, you mentioned bed sores. Bed sores are an absolute nightmare, and bed sores are not 100% preventable. When you listen to bureaucrats from the government talk, nursing homes must have high-quality standards to prevent bed sores. But I always like to think of the Christopher Reeve story, the fellow who played Superman and broke his neck in a horseback riding accident. He died of complications from bed sores, despite having his own private team of nurses and doctors on him 24 hours a day, 7 days a week. So you really can't prevent everything from happening despite the best of attempts. But when you do get bed sores, there are so many ways you can approach them, but none of them are great. Surgical approaches tend to be among the least helpful because the underlying reason you got the bed sore, you're sitting in one place, you're not moving, you don't tend to get much better when you do that. You just delay it until the next sore pops up. So if you can treat the bed sore with something that is low cost, not dangerous, not toxic, not difficult to apply, you may have a better chance of healing the wound. Plus, the simple fact that you're going in and doing dressings a few times a day means you're mobilizing the patient, you're getting the blood flowing better, and therefore you have a better chance of not having that same bed sore, which is also called a pressure sore, because it's just pressure, skin trapped between bone above and a firm bed below. You eliminate that by moving the patient around more.
Dr. Siegel, this sounds suspiciously like using a home remedy for something that's actually quite serious.
It is a home remedy. But then again, almost everything we use started as a home remedy. You go back a couple of hundred years ago in England, and there were people who would have consumption. And consumption was sort of a generic term. You got tired, you spent a lot of time in bed, you swelled up, you had problems, getting rid of excess fluid. That could have been lung cancer, could have been tuberculosis, it could have been cardiac failure. So they would treat you with home remedies, usually digitalis leaf. And if it turned out your reason for having this was some cardiac failure, the effects of the digitalis, one of the strong alkaloids in the plant, would help your heart pump better, and you would get better with a home remedy. So again, home remedies can be pretty good.
Lice aren't nice. And, when parents get the call, oh, your child has lice, come and get her, come and get him. Oh, that's the call from hell. And parents dread the repeat call, there are still nits, come and get your child, and back and forth and back and forth. There are some pretty potent insecticides that dermatologists do prescribe these days, but are there any other ways to get rid of lice?
Well, things one can try, I'm not sure the schools will be happy with it, but neem oil is very good at killing off critters, both microscopic and visible, such as lice. Pyrethrins, which you get in chrysanthemums, but again, the commercial products may be easier to put on than grinding up your own chrysanthemums, are options there. The popular thing right now with lice is to suffocate them with a moisturizer, Cetaphil, which is cetyl alcohol, which can be derived from a variety of plant sources, but again, it's not a straight plant application. But it does work well, and it's pretty non-toxic.
How do you use it?
Oh, you just slather it on. In fact, Cetaphil, which is one of the commercial products, someone was repackaging it with their own label, claiming that it was a special proprietary product. And what it does, you put it on, and essentially creates a thin coating on the lice, and they can't breathe, and it just suffocates them.
You're listening to Dr. Dan Siegel, Director of the Procedural Dermatology Fellowship and Clinical Professor of Dermatology at SUNY Downstate. He has served as president of the American Academy of Dermatology.
And we should spell that moisturizer cleanser. It's Cetaphil. How does that work again?
C-E-T as in Tom, A, P as in
Paul.
Peter, okay, H-I-L.
Cetaphil.
Yeah.
And it's widely available.
It is indeed, and that is the moisturizer, I believe he said. There's both a cleanser and a moisturizer.
And the thing that we've read about is using a hairdryer to kind of dry it into a helmet, and then the next day you just wash it out.
You wash it out, and the lice are gone.
We need to take a short break. When we come back, we're going to find out about fungus.
Just what is the difference between yeast and fungus that live on the skin?
Can you use mushrooms to boost your immune system?
How well do our favorite home remedies, Vicks VapoRub and old-fashioned Listerine, work against the fungus among us?
We'll also find out how to moisturize effectively. Mother Nature offers lots of options.
You're listening to The People's Pharmacy with Joe and Terry Graydon.
If you like the information you hear when you listen to The People's Pharmacy, you may also enjoy our book published by National Geographic. It's The People's Pharmacy Quick and Handy Home Remedies, available online at peoplespharmacy.com or at your favorite bookstore. Welcome back to The People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is made possible in part by Squatty Potty toilet step stools, creating healthy toilet posture for fast, easy elimination. More information about how toilet posture affects your health at squattypotty.com.
And by Redix Industries, makers of utterly smooth creams and lotions that deeply moisturize to make dry skin feel soft and smooth. 800-345-7339, online at uddercream.com.
If you would like to order a CD of this show, you can call 800-732-2334. This is show number 961. That number to call again, 800-732-2334. Or you can find it online at peoplespharmacy.com.
Today on the People's Pharmacy, we're talking about natural skin care.
Our guest is Dr. Dan Siegel, Director of the Procedural Dermatology Fellowship and Clinical Professor of Dermatology at SUNY Downstate. He's a former president of the American Academy of Dermatology.
Dr. Siegel, it seems like fungus loves us. And whether it's our nails or whether it's our skin, we are very vulnerable to these fungal infections, and they can be really hard to eradicate. The oral medicines that some dermatologists like to prescribe are a little on the toxic side. They can have some liver side effects. So I'm just curious, have you discovered any natural approaches to nail fungus or skin fungus, whether it's jock itch or athlete's foot, or something we hear a lot from women, breast rash or itch that may be fungal in origin?
Okay, well, let's divide out fungus first from yeast, because that itch under the breast, that's usually yeast, not a fungal infection. And that's the same sort of thing that you can get in the groin or underarms, though you can also get fungus there. And both fungus and yeast love to thrive in moist environments. So you take moist area in the body you want to keep moist, you just put skin on skin. It could be a pendulous breast, it could be an underarm, it could be somebody who's wearing very tight clothing that doesn't breathe well. You keep the moisture in, and these organisms that live on us normally, but not in dangerous amounts, they just go wild. If a reader wants to try this or a listener wants to try this, I wouldn't advise it, but if you take a shower, come out and wrap your arm in saran wrap for 24 hours, you will grow fungus. Don't try this at home. But as far as natural ways to go after it, what is very interesting is one of the early topical antifungals that was used in the 20th century was something called Whitfield's ointment. And Whitfield's ointment contained salicylic acid, originally sourced from willows, and it contained benzoic acid. And benzoic acid results from the distillation of benzoin, which is a plant gum or plant resin. And this combination, sometimes with or without sulfur, which also seems to be toxic to fungi, had been used for a long time for treating fungus, long before the creams we have nowadays, like Lamisil and Lotrimin, which are for the most part what are called imidazole creams. So there is a natural approach. There are also some oils out there, such as tea tree oil, which people have used for fungal infections. And tea tree oil does indeed work. The problem with tea tree oil is that when you open a bottle, it begins to oxidize. And while it doesn't lose its effectiveness, it does create a whole bunch of compounds that can cause allergic reactions, poison ivy-like reactions, if you become sensitized. So if you decide to use tea tree oil, my advice to people is get a fresh bottle from a reliable source, usually a small bottle, and use it up. But don't get the economy-sized pint bottle, because when you've got that open a bit and it's been sitting around a while, it will break down into all sorts of things that will cause nasty, itchy, eczematous rashes, weeping, oozing ones that are no fun for anybody. Now, on the topic of fungus, nail fungus is especially exciting. May I share an interesting anecdote with you?
Please.
Okay, I have a friend named Paul Stamets, and Paul is probably one of the most brilliant mycologists, those are fungus guys, on the planet. And Paul made an observation, and he's got a couple of friends treating with this now, using a product that's essentially a mix of a variety of dried mushrooms taken orally, and it seems to be clearing nail fungus in some of these folks. So it's intriguing for a number of reasons. One is that you're using a fungus to treat a fungus, though the fungi that people are consuming, this mix of mushrooms that seem to have immunologic stimulatory effects, are more likely revving the body up to treat the fungus rather than treating the fungus directly. So it's very intriguing. There's no hard science on this yet. We've been talking about ways to study this. It's tragic, but Paul's index patient, who was a dear close friend of his, recently died in a small plane crash, and we had seen pictures along the way of how his nails have been improving, and it's quite fascinating and intriguing. That
is intriguing, and we have heard about taking certain mostly oriental type mushrooms as a way of stimulating the immune system, but we had never heard that that might actually help the immune system fight off nail fungus. That is fascinating.
That's novel, but the idea of mushrooms helping the immune system is rather fascinating. And there's a couple of recent things that have come out. And again, your listeners can, because they may say, wow, this is just unbelievable about a doctor talking about this. There was a recent case of a gentleman with what's called a Merkel cell carcinoma, an uncommon skin cancer that quite often is lethal and is virtually always lethal if it spreads through the body. And there was a fellow who was diagnosed with a metastatic Merkel cell cancer. This was out at the University of Seattle in Washington, a major Merkel cell carcinoma treatment center. And he essentially going to get close to getting his last rites. He put himself on a healthy diet, raw food diet, and began taking mushroom supplements. And within a few months, all of his cancer was gone. Now, it's only one case, N of one, but it's quite intriguing and has led them to do other work. From the perspective of common cancers, there's even a use of mushrooms with treating breast cancer. One of the drugs that's become quite popular for breast cancer of late is Herceptin. And Herceptin is a nice complex chemical. It seems to be very valuable, but has side effects. Turkey tail mushrooms, used as an extract or a tea, may have some benefit, and it's important enough that the benefits observed to date are such that research is ongoing, and products that may combine the two should be coming out soon. So this is one more potential benefit of a natural product that people just hadn't thought of. Even common vitamins like vitamin D. If you were to take a shiitake mushroom, wonderful mushroom that is used in a lot of Oriental cooking, and very tasty mushroom, it's nice sliced up and sautéed with pretty much anything. I love them with anything. And you take them outside, nice fresh ones, and put them gill side up under the sun, you can induce them to make massive amounts of vitamin D, even if they've been picked, a few days in advance. This is quite a fascinating area, and it's a cheap and tasty way to get your vitamin D.
I'd like to go back for a sec to the nail fungus because many people have written in to tell us that they have been successful with some home remedies, one of which involves old-fashioned amber Listerine, half and half with white vinegar. And they do these foot soaks, usually for half an hour. And we've done some research and we found, first of all, that there are some antifungal ingredients in old-fashioned Listerine, one of which being
oil of thyme.
Oil of thyme. We wonder what you think about such an idea.
Oh, oil of thyme is actually a great product. For a long time, people have used oil of thyme mixed up with chloroform to treat infections under the nail fold. That's the part of the skin right at the base of the nail. You get infections under there. They can be painful, difficult to treat, hard to get to respond. And oil of thyme has been used, for a century or so. I had the experience shortly after 9/11 of being in my office and seeing someone with that problem, what's called a paronychia. Patient came in, we drained it, they still had problems under the fold, but because it was just after 9/11, the mails were not working, FedEx wasn't working, the pharmacy that was compounding this couldn't ship things out. So I sent the patient off to the pharmacy to get some oil of thyme. Again, pharmacy, health food store, they usually both have that. Even though it's an herbal, the pharmacies have had it for years. And then off to Home Depot to get some acetone. And you put a couple of drops of the oil of thyme into about 30 drops of acetone, mix it up, and you can just simply drop that on the nail. And what happens is the acetone wicks away and evaporates, and as it evaporates, the thicker oil of thyme gets drawn under the nail with what we call a capillary action wicking effect. And that has a very potent antifungal, anti-yeast, antibacterial activity. And unlike tea tree oil, which can be used in a similar way, it doesn't seem to break down commonly into sensitizing products.
Well, that is very cool. And of course, another thing that we have heard people tell us they have used for nail fungus treatment, another home remedy that also features oil of thyme as one of the ingredients, is Vicks VapoRub. And people say that if they apply it twice a day for a long time, you have to be really patient, some people get good results.
That's true. I've seen people who swear by that. I think a lot of the compliance issues that come out when people try things like this is that they don't want to stay with it for the months and months it takes. Because your nail grows at, depending on which nail and how good your blood flow is, you might get a half inch or so a month on a nail. So it's not very much in many people. So you've got to wait a long time for that to grow out. And that's optimistic on a healthy young person. Older person with diabetes, their toenails may grow out a fraction of an inch each month. So it takes a long time to treat. But the really bad nails, the ones that are especially thickened and yellowed and cracked and fissured, those are the ones where these home remedies often, in my experience, work better because they penetrate better. Your normal skin and your normal nail has great barrier capability, protects you from the outside world. But when things are all damaged, the outside world can get in, and in this case, you're putting the outside world on in the form of something active against the fungus.
Now, when you mention barrier capabilities, let's talk a little bit about moisturizing and lubrication, because I think that's what we're trying to do when we talk about moisturizing, is improve the skin's natural barrier capabilities, right?
Absolutely. The skin essentially is the protection for this whole big sack of complex organs. People think it's only skin, but inside you've got this liver, you've got kidneys, you've got stomach, colon, spleen, pancreas, lungs. All of that is being protected. The first line of safety for that is the skin that protects us and keeps everything in there. And the skin is best when it has a certain level of moisture, so it's moist enough to stay flexible, not to get cracks or breaks or fissures in it. If it gets too moist, then it becomes an ideal place, as we talked about before, to grow yeast and fungus and other organisms. So you want to keep it just right. And nothing really works to moisturize from the outside in. What happens with keeping the skin moist is that the moisture that's in your blood, that moisture is leaking out through capillaries, and some of that is not making it back to the heart. Some of that is helping to be lost through the skin but keeps the skin moist. So if your skin is dry, it means you're losing too much moisture. So how do you keep it in? You lubricate it. You grease it up. Now, you can use Vaseline, which is thick. That's a petroleum product. It's not arguably it's a natural product because it came from plants a couple of million years ago, but it's not a very elegant natural product and doesn't have anything that biologically can be helpful. But there's a whole lot of oils that contain essential fatty acids that are the ones that your body cannot make on their own, that are inexpensive, and they taste good. If you don't like to put it on your skin, you can eat it, which also can help somewhat, but not as much as putting it on the skin can do. The classic among these, from the point of medical use, is olive oil. Olive oil can be traced back over 2,000 years ago to Galen, who created cold cream, which was originally a mix of olive oil, a rosewater oil, and beeswax. Of course, this stuff didn't stay together. It wasn't emulsified like all the nice, cosmetically elegant creams we have today. The way you got it to stay together back then was you had to shake it up each time you used it. And you mix this stuff up and you smeared it on, and it worked well. That's why, it's still around for the most part. But it's not the only thing that works well. Really, any of the good seed oils are out there. You can use a sunflower seed oil, safflower seed oil. Now, olive oil is not a seed oil, it's a fruit oil because you're squeezing it out of the fruit of the olive, but all of these contain high levels of both linoleic and linolenic acid. And these are essential fatty acids that your body can make into other oils, so the body may actually metabolize some of these. And these are wonderful, and there is even recent work that's been done showing that using these natural oils, the oil choice being made by where in the world one happens to be, can help save lives. In Bangladesh recently, a study was done comparing a commercial product to sunflower seed oil. And the sunflower seed oil turned out to be absolutely marvelous. But the sunflower seed oil happens to be grown a lot in Bangladesh, is something that can easily be used to just moisturize with. And for my patients, I often tell a patient to try out olive oil first. If they put it on and it's too thick, I tell them to try sunflower or safflower oil. If they tell me that's too thin, I say mix them together. The only danger to using these oils as moisturizers is that if you put them on and then sit down on a good couch or a good carpet or a good rug, somebody may be very angry with you.
Right.
But there's no danger, and they work, which is the beautiful part of it. There's no rocket science. You put them on, you feel better, you feel soft, you feel smooth. You get a sensation that it's absorbing in. And it's not really absorbing deep into your body, but it's binding with the stratum corneum. And if you've got really dry skin, it's being picked up and it's sort of coating those skin cells and making them stay more adherent, and you're losing less moisture.
Well, let me ask you about a couple of other oils that people sometimes use for moisturizing and see what you think about them. Coconut oil?
Very effective, very safe.
What about
Great oil?
shea butter?
I love shea butter. Shea butter is my favorite natural lubricant, and shea butter is wonderful. I mean, when you open shea butter up, most people buy it in the health food store, those little 4-inch wide plastic containers, and the first thing you notice is there's an acrid smell to it. It's not an unpleasant smell, it's just not a smell you're familiar with. But once you sniff it a little bit more, you say, gee, this isn't so bad. In fact, if you've got a sore throat or cold, it's not a bad thing to smell that. It may be helpful there. Shea butter has unsaponifiable fats, which the simplest explanation is that these are things that don't go rancid. So it's got one of those shelf lives that last forever. Shea butter can be obtained in both refined forms and unrefined. I personally like the unrefined, and if it's too thick to be used, you simply mix it with an oil of your choice. Though my choice is really a liquid wax, that's jojoba wax, not an oil, because that too has a shelf life of forever, and you can make a moisturizing product that never goes bad on you.
Now, Dr. Siegel, what is shea butter? Where does it come from?
Shea butter comes from an African nut. It's also called carite butter. It's Butyrospirmium parkii, named after Mungo Park, one of the explorers who first described it. And it's squeezed out of these seeds, much like any seed oil, but instead of being a thin oil like an olive oil or safflower oil, essentially it's a thicker, greasy product. It's more white than Vaseline, and it cracks more easily. It doesn't flow as easily when it's at room temperature. When it warms up, it becomes very smooth and easy to spread around. But at room temperature, a little bit firm. That's wonderful stuff, and it tends to be harvested in an environmentally sustainable manner in most places. The trees aren't endangered, so it's very easy to get your hands on. And if you go to the cosmetic counter, you'll notice either it'll say shea butter, carite butter, or we'll use the Latin name, the Butyrospirmium parkii, on the label because it's a current sexy ingredient.
You're listening to Dr. Dan Siegel, clinical professor of dermatology at the State University of New York, downstate, and director of the Procedural Dermatology Fellowship.
We need to take a short break. Coming up, we'll talk about a natural but somewhat gross home remedy for athlete's foot.
We'll also find out why you might want to use the natural compound urea in your skincare products.
Some home remedies can even help psoriasis. How about a soak in the Dead Sea or a heavy regimen of curry?
You're listening to The People's Pharmacy with Joe and Terry Graydon. Thanks for listening to this podcast of The People's Pharmacy. If you like it, why not rate or review it in the iTunes store? We'd appreciate it.
Welcome back to The People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is brought to you in part by Squatty Potty Toilet Step Stools, creating healthy toilet posture for fast, easy elimination. More information about how toilet posture affects your health at squattypotty.com.
And by Redix Industries, makers of utterly smooth foot cream with shea butter, helping dry, cracked feet feel soft and smooth. 800-345-7339. Online at uttercream.com.
If you'd like to order a CD of today's show or any other People's Pharmacy broadcast, you can call 800-732-2334. Today's show is number 961. That number again, 800-732-2334. Or you can place the order online at peoplespharmacy.com.
Our topic is botanical dermatology. What skincare products come from Mother Nature and how well do they work?
We're talking today with Dr. Dan Siegel, clinical professor of dermatology at the State University of New York Downstate and director of the Procedural Dermatology Fellowship. He's also served as president of the American Academy of Dermatology.
Dr. Siegel, we've heard of something a little strange over the years. People say, well, I've got really smelly feet, stinky feet, and I maybe have a little athlete's foot, but if I just pee on them in the shower, it seems to work to take away the smell. And then we've heard from other people who say, yeah, urine works against athlete's foot. And then we've heard there's this thing in urine called urea, U-R-E-A, and it's even in some skin creams as a supposedly good moisturizer. And we read in the Journal of Investigative Dermatology a couple of years ago a very interesting research article that suggested that urea restores the barrier function of the skin. So what's the deal on urea? What is it and how good is it?
Urea is a very small molecule that the body makes, obviously, which, as you mentioned, is in urine. It was actually isolated from urine, hence the term urea. And it's very popular, and it is very good at drawing moisture into skin. In fact, it's so good that the Russians years ago had been using a urea paste made with 40% urea they would apply to fungal nails, and they would wrap this up in adhesive and have the patient come back in a week. You can smell the patient when they come back because it stinks to high heaven, but at that point you can take the dressing off and this bad fungal nail literally peels away. It's literally mushy at that point because it pulls moisture into it and traps it in there. So it's a great moisturizer. That's all pretty straightforward. The idea of peeing on one's feet in the shower, I'm not sure you get enough of a dose lasting long enough there because so many products work by having contact with your intended target for a period of time that lets them do what they want to do. I think if you would probably go in the shower, turn it off, and pee on your nails, and read that week's Time magazine, you might get some potential benefit. You might clean things up. Again, it's a nice way to debride, although water pick might be a little more aesthetically pleasing. But I'm not sure peeing on the feet in the shower is going to do much. Now, as far as odor goes on feet, there are a lot of different reasons people get odor. Some people, again, rarely have conditions that actually produce malodorous substances, but for the most part, it's moisture getting between the toes. If somebody who's listening to this has their shoes off and they look up with their toes, put their toes between themselves and the window or the light, the likelihood is they may not see much space between the toes. Women tend to wear high heel shoes that they get pushed into and gravity is scrunching the foot in and toes get deformed over time. And that skin on skin, that moisture effect allows things to grow. And if it's a tight environment, you get anaerobic bacteria that grow. And anaerobes have a sewer-like smell to them. And again, the urine may play a role in wiping those away. But a direct treatment of fungus, I'd be a little hesitant to try that.
Let us ask you about common summertime problem, and that is an itchy rash, poison ivy rash, for example, or mosquito bites, which is not a rash but is awfully itchy. Do you have natural ways to treat those?
You do, but there is controversy as to how effective they are. There's one plant called jewelweed, and jewelweed is a plant, it's called so because when it rains or even the morning dew, the water beads up in such a way that in bright light, it almost looks like little diamonds on there. And what's very curious is that where you have a lot of poison ivy, you seem to have a lot of jewelweed growing. And it's been said that if you take the jewelweed before you break out and you rub it on the area where you've got the poison ivy, it may attenuate some of the itching. Though to be honest, if I'm out in poison ivy and where I live, we've got poison ivy everywhere, if I think I've been through the poison ivy, I bypass the jewelweed, I head inside, I dump the clothing in the washing machine on my way to the shower and take a cool shower to try and rinse it off before it penetrates.
And I assume you use soap as well in that shower.
Yes, I do. And of course, soap can be thought of as a natural product. Because soap is, again, listeners may not know this, but soap is not something that in the past came from a factory, but rather you'd have your fire, and after the fire burned down, you'd have ashes left, and you'd mix the ashes with some oil, such as olive oil. and you'd make your Castile soap with that. So soap is also a natural product in that regard.
Well, of course, preventing the itch in the first place, the way you describe, by getting rid of the clothes and taking a shower is great. But what happens after it's too late and you've got that itch and it's just really annoying? I heard many years ago about oats or an oat bath. What would oats do for anything on the skin?
Okay. Oh, oats can be wonderful. Oats have oil in them that can be very soothing. And oats, when finely ground, they make a very nice gelatinous coating that can be very soothing and may have some anti-itch effect. There are commercial products with it, but you can also go ahead and simply get Quaker oats in the supermarket, grind them up in a coffee grinder to a fine powder, and you can add them into a bath, or you can make basically a paste you can thin out to comfort and put on, and that does seem to be helpful for itch. Now, oats are really wonderful for that purpose. They're also a great thickener for gravy and don't leave that starchy taste that regular potato starch leaves. You also asked about insect bites. If you have sassafras growing nearby, you pull the sassafras leaves off the tree, mush them up and rub it on for insect bites. It's somewhat astringent. Or witch hazel, which you can take some witch hazel bark and put it in some vodka or rubbing alcohol. It's a nice thing to help itch. None of these work as well as some of the potent corticosteroids, but then again, those aren't really fully natural, though they are naturally derived.
Well, speaking of something that's natural, you mentioned your backyard and you mentioned the 60s and 70s, and one of the things that people sometimes grew, maybe a little bit illegally, was hemp. And I'm curious, hemp is starting to get maybe a little more popular these days, not for abuse purposes, but perhaps for medicinal purposes. Is there a role for hemp oil?
Absolutely. Now, we should tell the listener that if you see a plant that looks like it could be hemp or could be marijuana, the question is, which is it? And the answer is you can't tell just looking at it. They essentially look the same. Of course, if you have a nice hybridized plant that has nice, bushy, thick, resiny flowers, it's more likely something that's been bred for its psychedelic effects. But hemp oil, which is extracted from the seeds, is a marvelous nutritional oil. It's very balanced. It's very good if you're deficient in a variety of nutrients. It's good like that, taken internally. It's also good applied directly to the skin. There is nothing psychedelic about it, nothing psychotropic. It's just a wonderful oil. You can cook with it. You can nourish with it. Wonderful product.
We have heard that there are some oceans that are especially beneficial. And in particular, we have heard that there's some research showing that soaking in the Dead Sea can be beneficial for people who have psoriasis. Can you tell us a little bit more about that, please?
Oh, absolutely. The Dead Sea is a spa that many European countries will send patients to have their psoriasis treated because it is so effective. You have multiple benefits. The Dead Sea, called so because the salt is so concentrated, because fresh water pours in but has no outlet, gets more and more concentrated. In fact, it's hard to get into the water. You float on the water because it's so dense. But when you're there, the combination of the intense salt that seems to help remove some of the scales, plus the intense sunlight you get out in the desert, is marvelous for psoriasis. And the desert, as a place to treat psoriasis, has been around since biblical days. When they would send people with leprosy out into the wild and tell them to come back when they were cured, they weren't treating leprosy. Leprosy doesn't get better with sunlight, but psoriasis does. And maybe those people out in the desert came across certain plants that contain phytocoumarins, which we call sorolins today, which have been used therapeutically along with sunlight or with artificial lighting to actually treat psoriasis and do so very effectively. These plants are not as popular as they were 20 years ago for treating psoriasis because the sorolins, when used in pill form, have a lot of side effects and people get skin cancers downstream. But as people probably used it a couple of millennia ago, where they would just rub on plant extracts, they probably got pretty good benefit.
What plants are they that contain sorolins?
Oh, common ones that we might run into are carrot tops, and there are a bunch of plants that you find in Egypt, papyrus-like plants that will do it. Off the top of my head, I'm suddenly blanking on the names of some of the others. Pretty much any plant that when you rub it on the skin and you go out in the sun and you get a nasty rash, contains psoralen. In fact, the classic one that comes to mind this time of year that we see a lot of in dermatology are people who go out and they will have tequila and lime, or they will have beer with lime, and they wind up getting a rash usually on one hand where they've been squeezing the limes, because the limes contain furocoumarins, and those furocoumarins are activated by sunlight, and they wind up getting this localized rash only in the area where the lime juice was dripping on them.
Now, when you were talking about the psoralen, you were implying that people might be taking them in the form of internal supplements, pills. And I'm wondering about other supplements that somebody might take for healthy skin, just in general, or possibly for specific conditions. Are there supplements you recommend in your practice?
The only one I recommend pretty much to everyone is vitamin D. Because we make vitamin D in our skin as a result of sunlight, we have to worry about not making enough of it, because most of us live indoors, we work indoors, we walk around clothed. Now, of course, someone will say, well, gee, why not just go out in the sun and make your own vitamin D, which is a great idea if you plan on dying at an early age. Genetically, we have advanced to the point where we reproduce in our teens, we raise the next generation, and then we can die. But we've managed to outlive that, so we live much longer, but our genetics is such that the skin cancers begin popping up 15 or 20 years after those intense sun exposures. So we really do better getting our vitamin D from other sources. The shiitake mushrooms we mentioned are one, and again, you can get vitamin D enhanced foods, but I'm hesitant to tell people to get the sunlight. I like to emphasize that point because people will think, oh, gee, he's telling me to go out in the sun, and as a dermatologist, you don't want to create more skin cancer.
Dr. Siegel, when we're talking about psoriasis, one of the things that some of our listeners have told us is that when they eat food that contains turmeric, or if they take turmeric as a supplement, that sometimes is helpful for their psoriasis. Is this something you're familiar with?
Absolutely. Turmeric contains curcumin, and curcumin is a known anti-inflammatory. I personally take it every morning for my hip pain, and it seems to be helping. I've been taking it for quite a while. It's wonderful. It's tasty. It's simple to work with. One can go to the health food store and buy capsules, or one can go and actually buy the roots, which look not unlike ginger, except when you cut them open, they're an orangey yellow. You can get the powder that's ground up and put it into capsules, or simply mix it with a bit of honey. Some of my Indian friends have told me that they will mix the turmeric into a sludge with honey and just put a small amount on a cracker or a carrot or a piece of celery. And by the way, celery is another source of furocoumarins, especially the celery leaves that we usually don't eat. But again, the turmeric is a wonderful product, really no downside to taking that.
Well, speaking of turmeric, we've also heard that people have done something pretty bizarre. They've made a paste of turmeric, which turns out to be very bright orangey yellow, and they've put it on warts. And they claim that the wart goes away, especially plantar warts, which can be very hard to get rid of.
You do have to be careful that you don't track it all over the house.
Or the sheets, for that matter. I'm just wondering, what do you think, and are there any other wart remedies that you're fond of?
Oh, lots. As far as that one, it's not one I've heard of, but it's worth a try. Along the lines of yellow things that work for warts, there's a plant that we see as a roadside weed this time of year where I live called a greater celandine, or Chelidonium majus. And this is a lovely little plant, has nice yellow flowers, and when you crack any part of the plant apart, the stems have a yellow sap that's sort of like a dandelion sap, but a bright yellow. And this has been used for a long time for treating warts. When I see a patient with warts this time of year, I tell them to get some and put a little bit on, cover with a Band-Aid, take the Band-Aid off the next day and repeat, and it seems to work quite well. And this has been used on both our continent and in Europe for a long time for treating warts. No one has looked into the mechanism as to why it works, but it seems to be effective. Other things include potato slices, banana peels, lots and lots of things, but not everything has good science behind it.
Dr. Siegel, one of the things we like to tell our listeners is that the most important ingredient in any home remedy is common sense. Do you have another message that you would like our listeners to carry away?
If you're going to try home remedies, know what you're getting. Make sure you're getting the right product from the right place. You don't want to simply trust something you read about in the Sunday paper. It's important to get things that are sourced properly. If it's something that you're going to use often, you might consider growing your own. You can grow, almost anything. You can grow your own thyme. There are recipes to make your own oils. But by all means, if it's something that's unusual, make your best effort to be sure that what you're buying is what you're getting. And remember that the difference between a poison and a panacea may only be dose, and that some things are wonderful in small doses but dangerous in large doses, be it a commercial medicine or a natural product. So you must be a little careful with some of these remedies.
Dr. Dan Siegel, thank you so much for talking with us on the People's Pharmacy today.
My pleasure. Glad to be here.
You've been listening to Dr. Dan Siegel, Director of the Procedural Dermatology Fellowship and Clinical Professor of Dermatology at SUNY Downstate. He's a former president of the American Academy of Dermatology. And we'd love to hear about your experience with home remedies for the skin. How have you treated fungus infections, itches, cuts, scratches, and warts? What's worked for you?
Lynn Siegel produced today's show. Al Wadarski engineers the program. Dave Graydon edits our interviews.
The People's Pharmacy is produced at the studios of North Carolina Public Radio, WUNC.
The People's Pharmacy theme music is by B.J. Liederman.
The People's Pharmacy is made possible by Redix Industries, makers of Utterly Smooth Extra Care 20 Cream with 20% urea for extra skin protection. The number's 800-345-7339, online at uttercream.com.
If you'd like to order a CD of today's show or any other People's Pharmacy broadcast, you can call 800-732-2334. Today's show is number 961. That number again is 800-732-2334. Or you can find it on our website, peoplespharmacy.com.
And when you go to the website, you can share your home remedies and you'll find a redesigned site. Please take a few minutes to look around and tell us what you think. There's a link to Dr. Siegel's website and lots of home remedies for common skin problems. You can also check out prescription drugs, herbal medicines, and home remedies, and you can share your own experience and thoughts about today's show.
You could sign up for our free online newsletter or the free podcast of the show. You need never miss another People's Pharmacy program again. It's all there at peoplespharmacy.com.
In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thank you for listening, and please do join us again next week.
We hope you enjoyed this podcast. If so, please consider taking a minute to write a review on iTunes. And thanks for listening to The People's Pharmacy.
This is an ad by BetterHelp. BetterHelp recently surveyed over 16,000 people and found that while 75% of people believe it's wise to seek support, only 27% of Americans are in therapy, and people stay silent to avoid being judged. BetterHelp has over 10 years of experience matching you with the right therapist. Because we're all better with help. Visit betterhelp.com/stopthestigma for their first ever State of Stigma report, the latest in mental health research.